Dentist, how do you avoid bone loss around a dental implant? Number one, don't forget your bone has to be different. What used to be adequate for your tooth is no longer adequate once an implant goes in. The reason is when the tooth comes out, the PDL comes out with it. You're losing internal vascularization to your bone around the implant. To compensate for this, your bone volume has to be thicker. Any bone that's less than a millimeter, typically it's purely cortical. And you need to have trabecular bone sandwiched between your cortical bone to give it the internal vasculature to support that bone. Number two, when you lose the PDL, you lose the shock absorbing effect that protects the thin buccal plate on a tooth, which will not be protected on an implant. You also have an avascular titanium surface for that thin bone to be against. How do you optimize the bone? Make sure you got minimum 2 millimeters of bone, buccal and lingual to your implant. When aesthetics is a concern, you want up to 4 millimeters of bone in the buccal of your implant. I put a little video together. If you're interested, check it out. Hope you find this helpful.